Hi friends, I am Dr. Chirag Arora. I am a shoulder, knee and sports surgeon at CK Birla Hospital and part of Saqsham Orthopedics. This is my friend Kanchan. She'll be introducing herself.
Hello everyone, I'm Dr. Kanchan. I'm a sports physiotherapist at Saqsham Orthopedics.
Today we'll be discussing about a very common thing, which is the role of physiotherapy in rehabilitation or post-surgical cases. This will help you deal with how and when can you join back your sports, and is the role of physio really mandatory? So we'll be answering these basic questions in a two-way communication. So let's start with Kanchan first.
So my first question to you, sir, is what is your general rehabilitation protocol post ACL reconstruction?
So see, first thing, let's start with this. Most of the patients are admitted in the morning of surgery. Surgery starts around 8 a.m. and it generally takes around 1 to 1.5 hours to finish a ACL completely. Majority of our patients, they end up walking the same day at the evening of surgery. We don't give a walker in our practice. We give a brace which is to be used for just 2 weeks. This is something which is different from other surgeons, and your protocol is dependent upon a surgeon to surgeon variation. Some people go very aggressive, some people go slow. But my protocol is at the end of 2 weeks, you should have almost a 90-degree range of motion. You should be walking without a walker and you should be not using a brace. The physio continues 6 weeks post surgery, and like we have an endpoints of 2 weeks, which are 90-degree range of motion, walking without walker and walking without brace. Same, there's a endpoints for 6 weeks, which is you should be able to do all your activities. You should get almost 130 to 140 degree movement, and there should be no lag in the extension side. This is the general rehabilitation protocol. Post 6 weeks, we start return to sports training. By the end of 3 months, we start use sports specific training. Between 6 weeks to 3 months, we start preparing your ligament for sports, which is in the form of balance training, proprioceptive training, and hamstrings or leg presses we start around 6 weeks to 3 months. The first sports which we start is the swimming. Again, that's wonderful for any ligament injury. You should always initiate swimming at around 6 weeks. Most patients are able to return back to their competitive sports by the end of 3 months. We very strictly make sure no patients get back to sports. When I say sports, that does not mean leisure sport. It means competitive sports before 6 months. From 3 months to 6 months, you can start low intensity sports. You can start playing friendly matches, but not when you play competitively. That's important.
And sir, how does this protocol changes if there is additional injury to ACL, like meniscal or PCL injuries?
Okay. See, this what our protocol I said, this is for general pure ACL injuries. If there is an additional meniscus injury, then we restrict the bending or we restrict active flexion for 6 weeks. Because बहुत केसेस में ऐसा होता है कि meniscus के साथ ACL डैमेज है, तो कई बार जो हम ligament harvest करते हैं, that is a part of the meniscal pull force. So we have to restrict that bending for certain time. Second thing is अगर multi ligament knee injury है, when there is an ACL, when there is a PCL, when there is an MCL, so कुछ component of bending हमें restrict करना. अगर PCL इंजरी है, we go a bit slow. Generally the rehabilitation जो 3 months पे होता है, PCL में around 4.5 months पे होता है. So there is a delay of at least 6 weeks after a PCL injury. And mind you, PCL damage is not very common in sports. It's more after a motor vehicle or a road traffic accident.
So my other question to you would be, how long it takes for a sports person to get back to sports and how many are actually able to do it?
See, when I talk about getting back to sports, I will say sports, if you want to get back to sports, there are two components to it. One is your surgical technique, which is done by a surgeon, and the other is your motivation level. We have seen people who are 55 getting back to sports after an ACL, and we have seen people who are 25 not getting back to ACLs, not getting it back to sports. So this is a very motivation dependent thing. Many people feel कि हमारा ACL टूट गया अब तुम खेल नहीं पाएंगे. So this is just a perception. With the right training, with the right return to sports protocol, majority, let's say 99% will be able to get back to their sports at around 6 to 8 months. Another thing is, बहुत लोग कहते हैं हमारा ligament change हुआ है. Are we prone for another ligament injury? Once your ligament heals completely, your ligament behaves as an original ACL. There is no increased chances of an ACL injury after a previous ACL surgery. The only end point in this is if your if your procedure has been done right, there is no additional chances of an ACL. Most patients, what I recommend them is 2 weeks of prehab prior to the surgery. That helps us to build the strength and that provides us a very good starting point for a faster recovery. Earlier, पहले क्या होता था कि ACL के बाद people used to stay for 3 days in the hospital, 4 days in the hospital.
Right, sir.
Now we are coming back to 1 day. If the insurance allows, maybe next time you'll see a daycare ACL surgery. Okay.
So in a nutshell, what sir meant was your post-op rehab is of utmost importance. These post-rehabilitations are equally important for sports or any other injured patient.
I think it's enough for it's enough of rehabilitation in a day. And what I want to tell you at the end is always discuss with your sports surgeon your rehabilitation protocol, your technique of surgery. And always choose your sports surgeon and your sports physio very, very, very wisely. Thank you and follow us for the more content. Take care.
Thank you.